I am Dr. Gavin Henry, a thoracic surgeon. I take care of mainly patients with lung cancer or lung malignancies. So when most patients come into us, they kind of know their diagnosis already. They have an idea. And then we normally just, number one, sit down with the patient. We take them through a course of almost like a field trip of what got them there, from their initial imaging studies and some of the discussions. And then we talk about any further testings. And we sit down and they really explain why you're getting this test and what the test means, different scenarios of different testings, and everything is written down. And then we may start going into surgical procedures if we know that. And then we really go into the details of surgery. 90% of what I do is minimally invasive or robotic. And so we tell the old version of what it entails and what recovery is. And then we say, okay, then we'll also, here's the minimally invasive or robotic. And then we describe in detail what robotic means. We say actually really it's robotic assisted. So not, then we say the robot's not doing the work, I'm still doing it, but we say it's just robotic assisted. And we describe the small details of the small incisions and the recovery. So we definitely tell them what type of surgery we're doing and how we're doing it. And then we sort of kind of start concentrating on the robotic aspect of it. The robot gives us the ability to see things that and do things that we can't really do open, or even the other minimally invasive. The robotic platform, or at least the camera, gives me 10 times my vision. So even with my own eyes, there's things that I'm seeing with the robotic platform that I can't see even whenever I do it open. Because of the degrees of articulation of the arms, I can only move my fingers and move my joints a certain joint, but the robot can move it in so many different angles. The incisions are smaller. Maybe someone robotically, at least definitely by the third or fourth week, they're already 85, 90% back. Some already talking about going back to work, making a big difference. So that's that huge difference that we typically see. I get to touch patients. I get to affect them in a way that I can see directly, that they can see. But then, the gift, patients like to give you gifts and things. That's like the biggest gift is that you have come back and told me that you have gotten back to your life.